All right, so this is day 2 for March, lower body, days Wednesday and Thursday. So the cable's gonna be set up. You're gonna have the rope on the right side, ankle strap on the left side. Both cables are at the bottom. We are gonna start with a specialization or a little activator set. It's not going to be as long as the other months have been. We have only 4 exercises. We're gonna take it back to 45 seconds on the right side for all 4. We'll switch and do 45 seconds on the left side for all 4, and that's it. So just 1 round for each leg. So we'll strap up the right leg first. Straight leg kickback, good glute activator. Last month we did the bent knee. This month we're gonna do straight leg. I like to hinge at my waist a little bit. Pull your belly button in, keep your back nice and flat. Exhale, use your glute and your hamstring to lift that cable. Make sure that they are squeezing their glute at the top. And one of the things I noticed is that my clients have been opening their hip so their toe goes out, using a little bit more of their abductors. So I've been trying to coach to keep that toe pointed straight to the ground as they lift. It's gonna keep their hips nice and square if they point that toe straight down. 45 seconds straight leg kickback. From there, they are going to stand next to their cable and they're going to kick towards the turf. They can hang on to the S-drive or their rig, whichever, and use their adductors, the inner part of their leg here, to move that cable, control, return. Then they're gonna turn around, they're gonna grab the opposite side of their rig or the S-drive that's next to them, and we're gonna do a knee drive. So it's pretty much hip flexion. We're just in a little bit of a different stance and it's got a little more power to it. So they're gonna drive that knee to their chest, control, release, and continue to drive. This is gonna really burn out their quad, have them look straight down and ahead, keep their spine neutral, pull their belly button in for a flat back, and exhale as they drive that knee. And exercise number 4, I don't believe we've done something like this. We're really gonna isolate that hamstring. We're gonna do a prone hamstring curl. So we're gonna lie down flat. Make sure the client's far enough away from the rig so that when they straighten their leg, they can get a full extension. They're going to flex their foot and curl their heel to their butt, keeping their toe pointed to the floor, okay? So that's really gonna isolate that hamstring. 45 seconds each move, and then they're gonna put the strap onto their left leg and do all 4 of those exercises on the left side. From there, we're gonna go straight into our first lower body circuit. We have 4 exercises, 30 seconds each exercise or each leg, 2 times through this whole circuit. So the first one is a low sumo squat with a plie. So they're gonna sink into a low sumo, hold it, and they're gonna lift their heels. This is going to burn the adductors, inner parts of their thighs, and a little bit of glute work, all right? Pull their belly button in, squeeze their shoulder blades together for good posture. From there, we're gonna go into 1.5 rep split squats. So we'll start with one leg, start in the top position, sink to the bottom, halfway up, all the way to the bottom, and then all the way up. 30 seconds this leg, down, half, down, all the way up. Switch legs, start at the top, down, half, down, and all the way up. 30 seconds each leg. From there, we're gonna take it back to our good old rope pull through, not sumo stance, feet slightly wider than our hips, shoulder blades together, pull your belly button in, nice flat back, hinge, take your chest and face to the floor, snap your hips, squeeze your glutes, and exhale as you stand. 30 seconds there. Then we're gonna go back to that split stance, feet about hip width apart. I like to stay on my toe so that I can get a little more out of this. My hamstring tends to be tight if my foot is on the floor. And we don't want a lot of rocking. I noticed that the last time that we did this. So they wanna put a lot of their weight on their front heel as they hinge, or on their front foot. As they hinge, snap, they're going to feel the work in the glute of the back leg. Belly button in, chest to floor, hinge, squeeze that glute. 30 seconds each leg. They're gonna do all 4 of those exercises 2 times through, and then we're gonna go to a lower body challenge. So the lower body challenge has 3 exercises. This is going to be 20 seconds on, 10 seconds off, 3 times before we move to the second exercise. The first exercise is unilateral, but we're still going to go 3 times through, 20 on, 10 off. So the first one is a split squat pulse. They're gonna pulse 20 seconds on the right leg, rest for 10. That right leg they're gonna do again the second time for 20, rest, and then the third time still on that right leg, 20 on, 10 off. Then they're gonna switch legs and do the same thing 3 times on their left leg. Then we are going to go into a low sumo squat pulse. And they're gonna stay down here for 20 seconds, rest for 10. They're gonna do that 3 times. And then they are going to do the supine S-drive push-pull. So I know that we did that this past month. It does a lot with the glutes and the hamstrings. It was really challenging, so we're just gonna stick with that again. Right lever all the way up, left lever somewhere between 1 and 4. Obviously the push is gonna be a lot easier than the pull. Lie on their back in front of the S-drive. I highly encourage my clients to grab that lower loop, pull their hips into the air, drive the belt forward with their heels, and then pull the belt back with their heels. 3 times, 20 on, 10 off, and that's gonna finish the challenge. From there, we're gonna go into a big upper body circuit. We have 3 blocks of work. Each block has 2 exercises, 30 seconds exercise 1, 30 seconds exercise 2 each side, and they're gonna do that circuit 2 times. So for the first circuit, we need to have the handles on each cable. And they're gonna go maybe not quite to the top. We're gonna do, they're at the top. Exercise 1 is a tall kneeling X pull down. So we're gonna grab the handles with our opposite hands, get in tall kneeling position, dig your toes in for good support, push your hips forward and squeeze your glutes. That's gonna protect their back. Start with their knuckles towards them. As they pull, they're going to rotate so their palms are towards them. Drive those elbows behind as far as they can and squeeze your shoulder blades. Round 1. Round 2, I would encourage them to put the other hand in front. It's gonna work it a little bit differently, okay? So 30 seconds, first exercise. Then we have a one-armed X pull down. The knee that's down is the arm that they're pulling with because this is half kneeling. So right knee down, grab the handle with your right arm, exhale, same movement pattern, same rotation. They are gonna have to use a little bit of their core and anti-rotators to keep their hips and their shoulders square. We don't want them turning their entire torso. They're just going to pull and keep their shoulders and their hips square. Then they're going to put the other knee down and pull with the other arm. They're gonna go back to the top, second round, tall kneeling X pull down, and then they're gonna finish that block with half kneeling, one arm pull down. Then we are going to go on to block number 2. So for this one, we are going to move the red levers to about our elbow, maybe 1 notch below. Exercise number 1, we are going to bring back that TRX chest press. So they're gonna be up on their toes, squeeze their glutes, pull their belly button in, take their chest to the straps, elbows go wide, exhale as they press away, okay? Exercise number 2 for this block is a one-armed wide elbow chest press. So they're gonna use the cable for this one. Leg that's back is the arm they're pressing with, elbow starts out wide, exhale, turn their anti-rotators on so that their hips and their shoulders stay square. 30 seconds that arm, other leg goes back, and we do the same thing with the other arm. They're gonna go back to their TRX chest press for round 2, and they'll finish with one arm chest press to finish out that round. And then round 3, the cables are gonna go all the way to the bottom. We have a half kneeling low to high fly. Whichever knee's down, doesn't matter. I would encourage the clients, round 1, put one knee down, round 2, put the other knee down. So dig that toe in, arm straight, soft elbow bend, exhale as they scoop up, pull their palms together in front of their face. 30 seconds there, then they're gonna drop a handle. The knee that's down is the arm that you're going to unilaterally low-high cable fly. other knee goes down, and then they fly with the other arm. Back to their 2-arm fly for round 2, and then they finish that with the 1-armed fly, 30 seconds each side. And that finishes out our upper body circuit. Then we're gonna finish with a lower body circuit. So that right cable, we are going to put the rope back on. We have 3 exercises. We're gonna do each exercise 3 times, 20 seconds on, 10 seconds off. So the first one, so that our clients can get back to squatting some weight, we have a rope goblet squat. So our feet are slightly wider than our hips. This is not sumo. Tuck that cable, tuck the handles in at the collarbone, keep their elbows tucked in nice and tight. They're gonna push their butt back, sink, stand, and squeeze their glutes. Again, encourage your clients to pull their belly button in and pull their shoulder blades back. We want them to work on their posture as well as get that lower body work in for their squat. So rope goblet squat, if your client absolutely hates that, I know that a few of our clients do, they can do a low rope, pull their shoulder blades back, normal squat stance, still not a sumo, sink, and squat. That will tend to pull them forward, so just make sure that they turn their core on and squeeze their shoulder blades to keep a tall posture. Then we're gonna move on to exercise number 2. This one, some clients don't like getting into the yellow or red zone. That's fine, we have an option for them. However, alternating plyo lunges is a really good exercise, so that's what we're going to do, all right? Turn your core on, sink as low as you can. If the client isn't into the plyo, they can do alternating lunges reverse, or if they wanna do forward lunges, they can do that as well, whichever feels better for them. 3 times through, 20 seconds on, 10 seconds off. And then let them catch their breath. We're gonna go from that plyometric to a hold. I did check this one out. I know we had some questions with the high heart rate straight into an isometric. However, I did talk with Sheldon. Going from the plyometric into this iso hold is only going to fatigue those muscles more. If they need some extra rest in between that plyo lunge and the squat hold, then give it to them. And we'll go from there. So that squat hold is 3 times through, 20 seconds on, 10 seconds off. From there, we're gonna go into our core. As we did for the last day, we're gonna start with that elbow plank challenge. Week 1, 30 seconds, week 2, 40, week 3, 50, week 4, 1 minute. They're just gonna hold that elbow plank, elbows under shoulders, back nice and flat, pull their belly button in and squeeze those glutes nice and tight. If they pull their elbows to their toes, it's only gonna activate that core a little bit more. Breathe in through your nose, out through your mouth. It's gonna contract and expand your abdomen and work your muscles even a little bit more. After that 1 elbow plank, we're gonna go into our core circuit, 3 exercises, 3 rounds. The first exercise, this one's new, but it's really good. It is a hollow hold, but we're going to kind of twist to the side. Probably shouldn't use the word twist. We're gonna rotate and use those obliques. So the one leg is out, the other knee is in, and you're hollow holding towards the direction of the knee that's up. Pull your belly button in, 30 seconds there, other leg goes out, other knee comes in, and you're hollow holding to the other side of the knee that is in, okay? If they need to put the straight leg on the floor rather than hover, that's an option as well. 30 seconds each side, then they're gonna go into mountain climbers. I would highly recommend coaching rather than having your clients drive as fast as they can. Focus on the range of motion so that they really can dig deep into the lower core. They're gonna get up onto their palms, underneath their shoulders, and they're gonna drive those knees as hard as they can and as far into their chest as they can, all while really, really pulling that belly button to their spine. If they do it at a good timing cadence and they drive those knees, they should really start to feel that in the lower part of their core. And then exercise number 3 is a supine frog pulse. So we are going to get into a position that's semi-familiar to them, the frog position for when we did glute bridges, except we're gonna hover our legs. So our soles of our shoes are together, our legs are hovered, and we're just going to do small pulses without our shoulder blades going back down to the floor, okay? Try not to call this a crunch, it's a pulse. Our shoulders don't hit the floor, pull the belly button in nice and tight, and they should really start to feel some work after a couple of seconds on that. So each exercise is 30 seconds per side or 30 seconds per exercise, and they have 2 rounds on that one. And that finishes out lower body.